The Occupational Therapy Mental Health Parity Act was reintroduced in May of 2023. The goal of the bill is to expand access to occupational therapy services for mental and behavioral health disorders. Occupational therapy practitioners face challenges in providing and billing services that do not address performance deficits. Occupational therapy practitioners are an underutilized member of the mental health team. We provide services in community settings such as community mental health centers, certified community behavioral health clinics, Medicare partial hospital programs, and assertiveness community treatment. There are barriers to the provision of occupational therapy services for people with a mental health diagnosis under Medicare. This would help Medicare beneficiaries more readily access occupational therapy services for behavioral health challenges impacting functional skills and help address the current shortage of behavioral health professionals. The Occupational Therapy Mental Health Parity Act was introduced in the 116th Congress and was included in a draft legislation that the Senate Finance Committee considered. We hope to build on this and see this legislation signed into law. aota President Allison Stover said that the legislation executes a vision in which occupational therapy is a typical member of behavioral health and mental health interdisciplinary teams. It also gives occupational therapy an opportunity to emphasize the value of therapy beyond physical health needs. We can show that including occupational therapy in mental health settings will improve patient outcomes for those with mental health diagnoses and behavioral health impairments, just like it has been proven to improve patient outcomes for those with heart failure, pneumonia, and acute myocardial infarction. The provision of occupational therapy services to Medicare recipients with a mental health disorder is clearly authorized by the Centers for Medicare and Medicaid Services. Medicare requires occupational therapy to be part of partial hospitalization services under statute and as a condition of participation. There is a lack of understanding of the role of occupational therapy in providing services in more traditional settings, including improving functional performance and decreasing distressed behaviors. Despite the clear statement of coverage by the Centers for Medicare and Medicaid Services, the Secretary of the Department of Health and Human Services must provide education and outreach to stakeholders about the provision of occupational therapy services to a person with a mental health or substance use disorder. More than 20 million Americans had a substance use disorder and nearly 1 in 5 had a mental illness before the swine flu hit. There is a documented shortage of mental health professionals with at least 152 million Americans living in a mental health professional shortage area. Occupational therapy practitioners face challenges in providing these services despite the need. The Occupational Therapy and Mental Health Parity Act will help make occupational therapy professionals more utilized in the mental and behavioral health team.